this meeting to order. Commissioner Plachek, this meeting starts when I'd like it to start. Thank you. So did that set the tone for my last and final Human Services meeting? Good afternoon, everyone. I officially call the Human Services Committee meeting, the December 12th, 2016 meeting, to order. First item on the agenda is the approval. We have a motion and support of the agenda as printed in our document. All in favor, any additions, deletions, adjustments to be made? Seeing none, all in favor say aye. Aye. Opposed? We have an agenda. Next up, we have public comment. Is there anyone that is bold enough to come forward? I will smile at you. I will listen attentively. Any public comment? Seeing no public comment, I think we really have scared them all away. We're moving on to committee items. We have the November 7th, 2016 meeting minutes in your packet. We have a motion and support of the meeting minutes as presented in your packet. Any additions, deletions, corrections? Seeing none, all in favor of approving those said meeting minutes, say aye. Opposed? We have meeting minutes that are now approved. Lifeway's monthly report. Ms. Mary Beth.
So good afternoon. I always forget it. Always still feels like morning, but it's actually good afternoon. So in your packet today, you'll find my report for the month of December. A couple of things that I'd like to highlight in your report. First thing, it's not in your report, but just a verbal report so that you're aware of the fact that I will be coming to the January study session in order to present the proposal related to the mental health millage. So I will be bringing that in the January study session. What was that? Yes. The other thing that I wanted to give the board an update on is related to activities that Lifeways is pursuing for ongoing grant opportunities. So we're doing things related to looking at, and I'm not going to steal the thunder because I know that Zoe will probably give an update related to the Handle with Care project, and that really is a vision of hers that she brought to the community in partnership with other stakeholders, and Lifeways will have a role in that. So I'll let her talk about that, but we are looking at ways to get funding to be able to serve and do things related to youth, especially around the state has an opportunity for a youth mental health block grant, which would look at opportunities for us to be able to provide mental health services prior to adjudication. So it's really important that we're pursuing that and looking at ways that we can partner with our community around that. The other thing that we're doing is we're also pursuing the state innovation model. As you know, Jackson was awarded, and one of the focuses for year one is related to emergency room utilization. And we have submitted a request as part of that funding for Lifeways to be a partner in being able to reduce emergency room utilization by having what's called a community living room model. And it's a model that allows for diversion out of the hospital. So we are hopeful that we will be able to receive some of the SIMS dollars to move that forward as a community, and that would be very beneficial for all of us. I really hope that it does happen. I have positive feedback that it will. The other thing that I wanted to update you on is related to the Certified Community Behavioral Health Clinic. The state of Michigan did submit their application. Now it's a matter of waiting to find out whether or not Michigan was selected to move forward with that model. It is important because it allows for a federal funding for community mental health. And as I've talked about before here, Lifeways is preparing itself to be able to meet those standards, and because after 2 years they will look at expanding it statewide. So that's important. Stay tuned as we wait to hear whether or not Michigan was selected. I hope with the fact that Senator Debbie Stabenow was the one that passed this bill, and she's from Michigan, that there is high hopes that Michigan will be selected as a pilot. The other thing that we've talked a lot about is related to the challenges that we see for inpatient, psychiatric inpatient needs across the state. So we've been collecting as a region, because Lifeways is a part of that 21 county region, 12 community mental health. We've been collecting data since March related to the utilization and denial of inpatient across the 21 county region. And one of the things that we've been able to collect indicates related to the level of individuals who are denied, so it's quite high. So, and there's a variety of reasons why somebody will meet criteria for inpatient psychiatric services and the hospital will deny placement. It can be the fact that the hospital has an opening for female and the individual is male. It could be the fact that the individual is geriatric and there isn't an opening for a geriatric patient. So it's a variety of reasons. But one of the biggest challenges is the fact that many of the individuals who are being denied is related to that they have high behavioral health needs and the hospital not feeling that they have the capacity to meet that need. So we are looking as a region how we might be able to support our local psychiatric hospitals with that issue. And in the meantime, the Certificate of Need Committee, which authorizes and determines the level of inpatient placements across the state at each of the psychiatric hospitals, is looking at expanding capacity so that there will be more beds available across the state. So that's an important thing to be aware of. The other thing that's happening as a region is that Mid-State Health Network, as you know, is the coordinating agency now for our region. And they're looking at having each of the community mental healths be a site for distribution for Narcan for our patients, so individuals that we serve, and having Narcan on site if it's needed. So I just wanted you to be aware of that. There's also, and I'll talk about that shortly, about some bills that are out there. There's several bills that are currently out for the House and the Senate related to expanding Narcan availability. When you look at some of the lame duck bills that are out there right now, the ones that are important for the community mental health, the first one is related to Kevin's Law, and this one allows for the expansion of the definition for the courts to be able to deem somebody and require that they have treatment. And one of the challenges, and I'll just say this from the community mental health perspective, is we don't know what the capacity is going to be related to judges requiring individuals to have mental health treatment. And so there's some concern that because we don't know what that level is going to be, that there's going to be a greater need and individuals will be referred who do not have Medicaid. And then there will be a concern related to the fact that we do not have general fund dollars across the system to meet that increased need. But we'll just have to watch it. I mean, we'll just have to watch now that it's being implemented. This law has been signed and watch the data related to the number of individuals in our community who are being referred through this Kevin's Law for treatment. The other thing that's important to look at is related to the bill that's out there related to assaulting an individual with a disability. So they're going to increase the penalties for somebody who knowingly, so that's the important component of this bill, is somebody has to know that that person that they assaulted had a disability, whether it's a physical disability or a mental health disability, and they were assaulted, that the crimes are higher if you assault somebody intentionally. The other one that's out there that's important is related to the GF funding formulary. So, I've talked about the challenges that Lifeways faces related to general fund and the fact that we've had a 70% reduction in our funding. And there is an equity across the state related to how community mental health are funded with general fund dollars. A good example is there is a similar CMH within our region who has the same level of individuals that they serve in their community, just like Lifeways, and their funding level is almost 3 times greater for general fund dollars than Lifeways. A lot of the funding has been done historically based on if you utilize your general fund dollars, then you continue to be funded at the level of utilization. So the historical use of general fund dollars, this bill that's out there is really trying to get at creating equity across all 46 CMHs related to general fund and how that is distributed across the state. There will be winners and losers, as you can imagine, so there are people both in support and not in support of that legislation. The other one that's really important is related to the seclusion and restraint in schools. As a community mental health, we definitely support this bill. The schools are the only setting that still allows seclusion and restraint. We don't allow it in our, we don't allow it in the CMH system, even in the prison system. There's very strict rules around the utilization of seclusion and restraint, yet this is allowed in school settings. So this bill, there's a lot of hope that this bill will actually go through. It will require some strict guidelines on the utilization of seclusion and restraint, when it can be utilized in only emergency situations, and it will require that individuals keep track of and record when it's being utilized. There'll be a reporting mechanism. So this is a bill that we're definitely in support of and hoping that will move forward. And then lastly, in that packet, you'll see a couple other bills that are important related to Narcan and the use of Narcan in a variety of different settings, from the schools to the prescribing and availability at pharmacies, as well as within the correction system. So I think these are all important bills when we talk about the increased need that we're seeing in our communities related to opiate overdoses and heroin overdoses. So these are three important bills that I wanted you to be aware of. And that is it for my report. If there are any questions of the board?
What comments or questions might you have for Mary Beth? Phil? Commissioner Duckham?
Do you know if there's anything pending in Lansing to allow over-the-counter Narcan sales?
That would be, I don't know about over-the-counter. I mean, you could get it at the pharmacy. That's what the one bill would allow individuals. If you have a family member or friend or something, you could go to the pharmacy and then be able to get...
It's not a prescription. You just buy...
No, I don't know that there's anything related to being available over-the-counter.
You just did it in Ohio.
They did it where? I'm sorry? In Ohio. Okay, no, I'm not aware of any bill that's currently being proposed.
You walk into a CVS pharmacy and buy it.
Wow.
And it's not hanging on the shelf. You got to go to the counter.
Right.
But you don't need a prescription, and it's relatively inexpensive.
Oh.
All right, thank you.
Yep.
Any other comments or questions? Seeing none, thank you.
All right, thank you.
Next on the agenda, we have the DHHS quarterly report. Zoe?
Good afternoon. Thank you for having me here, and happy holidays to you all. Just a couple of things that I wanted to highlight in our report. So first is our Employer Resource Network. If you recall our presentations in the past about Pathways to Potential, where my office has workers that actually sit in schools and assist the schools with attendance through the use of resources that our office can provide. So if people kids have problem with attendance and it's related to transportation, if it's related to oversleeping and they need a resource in the home that maybe is an alarm clock that my staff could help purchase. If people are sick and Medicaid is an issue, my staff is a resource to the schools and to the families to keep kids in school. Employer Resource Network is a very similar type program where my staff would actually sit in a business in the community and help the employees of that business deal with any problems that they have in terms of resources that would help them be able to continue to work and not have to take time off work to, for instance, come to my office and apply for any type of assistance that they might need. We did a community presentation, we've done 2 community presentations now, and there's some interest in getting this accomplished. Just to let you know, the businesses within the community that have participated and seem interested at this point are Jackson County ISD, Orbit Form, Arbor Manor Rehab, Elm Plating, Lifeways, Excel Staffing, and Manpower. So just to let you know, those are sort of the businesses within our community that are interested in this model, and we continue to meet with them and are hoping to have this maybe in place in the next 4 to 6 months for some of these businesses to support folks staying at work. In terms of community collaboration, I provided you with an attachment. I have a couple of attachments in this month's report just to sort of let you know what my office participates in within the community. This is actually not just 1 month. It's about equivalent to a quarter. And as I was reviewing it, I could see that there were some meetings missing. But it just lets you know what, even though we're a state agency, the things that we participate in our own community. And interestingly, as I move on to Handle with Care, which Mary Beth talked about, trauma is such a big part of what we're going to be working on in our community. And I looked at this list of all of the meetings that we attend and put a T next to the ones that involve trauma. Almost every single one of them is something that we're working with people in our community who have been traumatized. And it doesn't matter if it's a social service type program or an employment type program. We, as in Jackson, are becoming a trauma-informed community, and so many of these services and supports need to be aware of trauma in order to best deal with the folks that we are working with. So just to keep that in mind, that trauma is something that's really strongly happening here. In terms of Handle with Care, I provided you with a overview of Handle with Care. This overview is actually straight from a website in West Virginia. So it's not the Jackson, Michigan version of Handle with Care, but we are replicating this almost to a T. So we are piloting in Jackson County. We are the first county in the state to do this. The short little italicized paragraph that I gave you in my report is really the basic nutshell version of it. And what it is law enforcement is going to be in contact with our schools whenever they are on site and children are present at a scene. So it could be a motor vehicle accident, it could be a domestic violence, it could be a parent being arrested in front of their children, it could be a drug overdose. Law enforcement is going to start looking specifically for when children are on scene. They're going to get the child's name and their school, and before school starts the next day, they will have communicated to the school a simple comment, the child's name and Handle with Care. The school then will be able to respond to that child and any behaviors that that child might be having in a different manner than if they have no information and they just have a child who is misbehaving, who is fighting, who is sleeping, who is just not acting themselves. And the third piece of it, which Mary Beth talked to, is if there are children who the school just responding in a little bit different way to that child's behaviors doesn't take care of the need that that child is having, then there will be on-site mental health services that we can connect the child and the child's family with. We have commitment from Lifeways, Family Service and Children's Aid, and Center for Family Health in our community to help provide that additional resource of mental health counseling for those that need it. When we went to West Virginia in October to learn about implementation, we were told that about 10% of the kids who get a Handle with Care notice need that further assessment and that further therapeutic resource. We're hoping that it works out the same here in Jackson, because 10% we believe is something that we can provide. And so we're going to put this in place beginning January 9th. That's our goal date. And meet monthly from January to June to sort of figure out how it's been working with the schools, with law enforcement, and with the mental health providers. And then next summer, as we have a break between school years, we'll amend anything that we need to amend, and hopefully have a very strong program in place then for next school year. We've received commitment from all of our school districts, all of the superintendents and all the school districts in the county. In the last couple weeks, I've also contacted all of the non-public school districts, so the Catholic schools, Paragon, JPEC, Trinity Lutheran, have met with talked to all of them. They're also on board. And we have commitment from all of our major law enforcement agencies, Sheriff's Department, State Police, Blackman Township, and Jackson City Police. And we will be meeting with all of the other chiefs on next Tuesday, December 20th. So as a community, it's something we're just really excited about. And when I hear Mary Beth talk about seclusion and restraint in schools, I think about this program, and I think, if our schools have a heads up as to just the fact that a child might have trauma, even that could help reduce the seclusion and restraints in schools. So we're pretty excited about it. Next thing on the report is our contracts that DHHS brings to the county of Jackson. So you should have all received a spreadsheet. So through our office, we bring state and federal funding to the community through our contracts. And Brad Williams, my board chair, asked me to provide this each year, so that you can just see as a county commission board what we bring to the community in terms of monetary resources. Certainly through our child care fund, we also use funds through the county, but we also bring work to the people who work through these contracts, and of course resources to our community members who use them. So I'm happy to answer any questions that you might have in terms of a specific resource or anything with regard to that.
Commissioners, any comments, questions? Thank you very much, Zoe. Thank you for all you do for the kids in our community. Your innovativeness and your willing to reach out to research what other states are doing simply makes our environment better here.
Thank you.
Next on the agenda, we have the medical care facility quarterly report.
Good afternoon, everyone, and happy holidays. Under finance, our census has fluctuated up and down slightly over the last quarter, but we're still ahead of budget. Our 2017 budget is nearing completion, and I'm meeting with the DHHS board on Friday to review that. The intent for filing a CON letter has been filed and accepted for the renovation project at JCMCF. Preliminary plans for state and fire marshal input are being drawn for plan review prior to submission to the state. All of our financials, bank statements, AP processing, AR, and financial issues and concerns have been reviewed by myself. Billing and collections are timely, and required Medicare oversight is in place. Our follow-up on all of our audit recommendations has been completed from our previous year's audit. That's all done. JCMCF has contracted with our local PACE provider to provide respite and hospital aftercare services. It took us a while to get together, but we got there. Audit bids were sent out in August, and the board approved the Lally Group PC for the next 3-year cycle of financial audits. JCMCF has worked with this group before, and we look forward to working with them again. Under people, we have settled both AFSCME units, both our 139 unit and our 2098 unit this last week. Our residents have voiced no concerns of any substance in the past few council meetings. All minor issues were immediately addressed. Our resident care partner and visited incident reports were reviewed continuously by myself, and there are no evident trends that require attention. Core team and fireside chats continue with our care partners. Our October Harvest Home Dinner and our Halloween celebrations were huge and wonderful. We did not get flooded with trick-or-treaters because someone did not put it on Facebook this year, which saved us. It is with very great sadness that I announce our Director of Nursing is retiring. She is going to do some consulting work, but she does not want to work full-time anymore for a variety of reasons. She loves us very, very much and will stay in touch, but she will be retiring January 10th. We will be starting in January trauma-informed care training to all of our care partners at JCMCF because we feel that that is critical to provide. It's through a grant program, this training, and we will be filming our training so we can eventually train all of our staff. I am wearing a button, and you all are welcome to have one, that refers to our ugly Christmas sweater day at the Care Center. And it will be next Wednesday if you're so inclined to wear an ugly Christmas sweater and join us. It's an all-day happening. The Human Resources Department, Nursing Department, and Administration are working together over the next couple of months to just improve and tweak our onboarding process in an effort to make it a little bit more engaging and educational. Under service, we continue to use social media to honor our care partners' years of service. All newsletters, articles, and reports were distributed timely. We continue to offer free meeting space to the community if they would like to use any of our rooms after our business hours, sometimes even during. We continue to participate with the Regional Emergency Planning Group in Lansing and provide monthly bed availability updates so that in case of emergency, we know where we can send people. And we continue to, I said that twice, excuse me. Quality. We continue to score better than state and national peers in several extremely important fronts, including antipsychotic medications, zero acquired pressure ulcers, excellent turnover rate, and very low hospital readmissions. We continue to work on the Governor's Award. Final reports go in this month, and we will receive the results as to whether or not we have achieved this sometime in early March. And finally, growth. We're in the planning stage of our renovation project and will report our status and progress to the Building Authority, HS Committee, and all others that we're required and advised to report to. We have begun the process of assessing the upstairs community space and how we're going to reapportion the 16 beds that will be coming downstairs. The flat roof project was completed and the warranty is now in place. And the only remaining work to be done in the lobby is some small pieces of trim, and that is being built for us right now. Any questions for me?
Commissioners, what comments or questions? Commissioner Placzek?
Yes, sir.
More of a comment than a question. Your little television ad, you look
Oh.
great in that, and
I look like I belong there, that's for sure.
it's a very nice little,
Thank you so much. Those are so much fun, and the residents just absolutely love to do it. We talked about not doing it this year because they changed stations, and the hue and cry from upstairs was such that we just figured we'd better continue the tradition.
Seeing no other comments or questions, thank you very much.
So much.
Next on the agenda, we have Department on Aging Monthly Report. Ms. Marcy?
Good afternoon. This month's report is an update for something that I talked with you about in April, and it has to do with Meals on Wheels participants when they're not home, because Meals on Wheels are intended for people who are primarily homebound, and if they need to be away, perhaps for a medical appointment or another reason, we expect them to let us know, because when they're not home, we think the worst, that something may have happened. So we contact an emergency person. Some participants do have provision where they have a cooler with ice, a clean cooler with ice that can hold the meals. Again, it's so that we know that they're okay. So since February, we have been more intentional about documenting how many times we've let people know what the process is as far as if they're not home and they don't tell us. So they're told initially before meals start, and then after the first time, or during the in-home assessment, it's explained, and then after the first time, if they're not home, it's explained again. And they're told, if the third time, then we'll have to do a reassessment, perhaps you're not homebound. After the second time it happens, they're reminded again. So after the third time, either they say, well, really, I'm not homebound, stop the meals, or we do have a social worker go and do a reassessment and talk with the person again. So the number of times that this has happened where people aren't home and they don't notify us, it did go down quite a bit by 42%. So we think that's a significant drop. The number of meals has not gone down as far. So we're now going to keep track of whether the participants who have a number of meals delivered at one time, if perhaps they're a Medicaid waiver participant, and in those situations, we do not do the in-home assessment. Another agency does. So we're going to work on this further and just check on why the meal count hasn't gone down as much, although it did go down. The number of meals returned to the Department on Aging did go down by 27%, so that's good. So we're still looking at this, but the progress has been good. So I just wanted to let you know. Any questions about
No, and I
anything?
did hear on the radio this morning that no Meals on Wheels today because of the public schools being closed, so I thought that was advertised well. The fact if I could hear it on the radio coming in. What other comments or questions might you have for Marcy?
And by the way, people get emergency meals in November for days such as today. So they do have food that they can eat for today. And we replenish those emergency meals depending on how many snow days there are. So, yeah.
Thank you for that additional information. Sure. Off topic.
Well, it's a
Chatwell?
Department on Aging question, but it's maybe a sister agency in Ingham. I have some people up there that have become homebound and relatives are taking care of them. Is there a contact source there for them to get the kind of services we provide? Whether it be respite care or anything. Is there an organization that they can contact up there? Because they're at their wits' end. They're not able to get any type of communication started.
Okay. It's called Tri-County Office on Aging, and I can send you a link, but,
If you would, I'd appreciate that.
and they
very, very
serve
much.
Ingham, Eaton, and Clinton. Mhm. Yep. Okay.
All right. Any other issues Marcy can help us with? Know anything about radios? No, just joking. Wrong meeting. Thank you, Marcy. Thank you for that information. Next on the agenda, we have a variety of contracts that need to be dealt with from the Health Department. So following all of those contracts that need to be authorized, we have Richard here already for his monthly report as well. So let's start with letter F, Health Department, looking at the agreement with the United Health Plan.
Good afternoon, Commissioners. Thank you, Madam Chair. We do have 3 agreements for you today. The first one in your list is United Health Plan. These are all with Medicaid health plans. These are the last 3 of the original 6 that we talked about with you earlier this year that we need to enter into as far as agreements are concerned, specifically due to a state changing requirement that we bill Medicaid health plans for maternal and infant health program services versus fee-for-service. So that's really what's driving all these, but there are some other benefits and I think gains that are occurring to us as a result of entering into these contracts. We can bill for a wider array of services. We've already started to move in the health department toward being able to have our medical directors see a few patients that come through the building that are testing positive for tuberculosis skin tests. He can see them initially, and then our nursing staff can follow up with them to do directly observed therapy if they need to. But that's just one example of something additional we'll be able to bill to the Medicaid health plans that we couldn't do before. So we're pleased that we're able to do that. The content of each one of them is slightly different, but that's just the nature of health plans. But overall, they've all been reviewed by legal counsel, and they were all comfortable with all of these contracts.
All right, thank you. Seeing no other questions or clarification from Richard, we'd be looking for a motion to approve this agreement with United Health Plan. We have a motion and support. All in favor, say aye. Aye. Opposed? Motion passed unanimously. The next item on the agenda, letter G, the Health Department Medicaid Auxiliary Services Agreement with Aetna Better Health.
Basically, completely same purpose and same process, if you will. With Aetna Better Health, their contract is probably, I guess, 4 times larger than anybody else's, but they just have a lot more language in it. Most of the additional language that's in some of these contracts doesn't really apply to us because we're not a healthcare provider, if you will. So none of those are concern to us, and they weren't a concern to legal counsel either. Nothing really different about this one than the other 2 that you already processed. This one just happens to be with Molina Health Plan and is the 3rd one in board docs today that we would ask for your approval for. Thank you. My monthly report is in board docs with you today. Just a few things I wanted to point out in the report. Under administration, I identified Lunch and Learn, and I just wanted to let everybody know that this is part of one of our high-performance organization efforts at the health department in conjunction with the work that we do through our advisory team. We kicked off our first Lunch and Learn on November 15th, was well attended. We had 14 staff members participate, and it was a leadership and cultural competency building effort with a TED Talk by Sean Akor on the topic of the happy secret to better work. And we plan to do these on a monthly basis going forward for the next 6 months, and then evaluate how staff are appreciating them and whether they're liking what they're getting, and move forward from there. I have an accreditation review update. The whole process has been completed now for us. That was started back in in October. And we will receive the final report on our accreditation standing, if you will, and the Accreditation Commission's January 12, 2017 report, and then we can report back to you on that. We fully expect to be credited. We had 2 minor deficiencies out of about 106 particular minimum program requirements that were evaluated on. So we did very well, and we've already corrected the deficiencies that were identified in our Children's Special Health Care Services program. So no major concerns there. They're primarily administrative in nature. A lot of work continues on page 2 at the top, talking about health integration with Henry Ford Legion's Health. A lot of work continues on the state innovation model planning and design. As you can see from what I've described in that paragraph, quite a few number of key positions have been brought on board through Henry Ford Legion's Health to support the SIM project, including a project manager for SIM. Some of these haven't been filled yet, but the project manager, the network manager has been filled, a network assistant, a community social services hub coordinator, and a community clinical liaison. So those are all positions that have been at least approved initially through the HIO Coordinating Council, which is the Community Health Innovation Region for Jackson County. And I've described a little bit more about some of the other entities and organizations that Dr. Schultz and her staff will be contracting with to support the SIM project. We do have some retirements going on in the health department. One of them is Peggy Taylor, a registered nurse. She's been with us for 31 years and has worked almost exclusively in the Children's Special Health Care Services program. And so we are busy recruiting for her position as we speak. We did have an influenza-like illness outbreak in November in one of our long-term care facilities here in the county. It was closed to visitors and units were locked down in November because of the illness. It affected 3 of their 4 units. No employees reported symptoms, but 9 residents were febrile with upper respiratory infection. One was actually intubated during an admission in Henry Ford Legion's Health Hospital, so in the ICU. That was pretty serious. The person did recover, and we're glad to hear that. But it was this resident in the hospital had an actual positive rapid influenza B test, which was a little unusual. B usually is considerably less severe than influenza A strain, so we were kind of surprised that B was the first thing that kind of showed up in the community in conjunction with an actual hospital admission. So there's a lot more information there about how we coordinated with them and the regional epidemiologists and got specimens submitted. But as it turned out, the results actually indicated 2 types of parainfluenza viruses were responsible for the illness, and it wasn't actually the rapid positive test of influenza B. So these tests do have some variability, and there's some error rates that are built into them. So I think that when they do the actual culturing, they actually find out what the root cause particularly was. And these parainfluenza viruses are not part of a flu vaccine. They just circulate in the community. Under health education and health promotion, so there's some abstinence program updates in there. The Teen Advisory Committee hosted a teen panel for the middle school at Parkside 6th grade. And we do have a lot of good participation in the abstinence program and the Teen Advisory Committee and the councils that work together. And the middle school at Parkside was the most recent location that we went to participate in the forum. And they were very happy to have us come and are going to welcome us back again. The Great American Smoke Out was November 17th. We did do a press release related to that. We do have a much higher than average smoking rate here in the city of Jackson as well as in the county, 36% in the city and 30% in Jackson overall, which compares to about 21% in Michigan. So it is one of our key public health issues we have to continue to work on here in our community. I provided some WIC program updates for you as well. We're making good progress in using the additional clinic and office space that used to be occupied by the immunization clinic, and now the WIC program has expanded and moved into there, and they really needed the space. So everything is working out well with the improvements that we've made, and we're very happy with the outcome that we're seeing. The Breastfeeding Coalition here in the county hosted a holiday party for breastfeeding moms and their children as part of the monthly Bosom Buddies breastfeeding group. And it was well attended, and we like being able to do that with partners in the community. The Healthy Communities Update, Loomis Park Master Plan. As many of you are probably aware, Julie Weisbrod does a lot of work with the Walkable Communities Coalition and with Loomis Park in general, and has continued to apply for grants that support opportunities to increase utilization of the park and contribute to physical activity increases within the city of Jackson. There's a teen pregnancy prevention program update on my report on page 4. We are also recruiting for the community health coordinator position that was occupied by Renee Marks. Her last day is Wednesday this week. And Ann Sloan, a master's in social worker trained person in our maternal infant health program, has accepted the position, and she'll start in December, has already started, and is overlapping with Renee a little bit. Safetyville Final Report. This is a program funded through the Jackson Traffic Safety Commission and that particular advisory group. And we did have 948 students attended Safetyville from 17 different elementary buildings, 7 school districts, 4 private and 2 charter. And we were actually up in terms of the number of classrooms attending from 39 to 43. So that was a very good outcome for 2015. I think I previously talked about the hepatitis A investigation in imported frozen strawberries from Egypt. That entire investigation has been completed. None of our local facilities had received the potentially contaminated strawberries in question, and so we certainly have had no cases of hepatitis A associated with that outbreak that occurred in mostly other parts of the country, but there was some concern about consumption in southeast Michigan. And the MDR will be working on an after-action report for that. That's one item that's not in my report I just wanted to talk about briefly is that we had quite a few staff at the Health Department attend the drug summit last Friday. I don't know if anybody here was able to attend, but it continues to be a great concern to us as a public health issue in the community. We had 20 overdose-related deaths in 2015. It looks like the estimate is going to be that we may have as many as a total of 50 in 2016, so we really have an overdose death-related epidemic on our hands in the community. So we're ramping up our public messaging and public health advisory work with the community. We'll be participating in all of the work groups or committees that are appropriate for us with Prosecutor Jerry Jarzinka and the task force. And we just got to be doing more than apparently what we're doing because this problem is getting worse. And as you're probably all aware, carfentanil has now been detected also in the community. So we have a public health advisory being reviewed by Dr. Mano, our medical examiner, Dr. King, our chief medical officer at Henry Ford Legion's Health, and through the ME's office as well. So we're hoping to get that out as soon as we can. So that's my report, and I'm happy to answer any questions you might have.
Thank you, and I'm very pleased that you had a presence at that summit. I've attended all three, and in each time, the stories are just heartbreaking. And when you look at the impact on our community, it's very important and vital that you have that presence there, so I'm very pleased.
Yep.
Seeing no other comments or questions on the monthly report, we will now move on to your annual report.
Thank you. I'm a little late in the year, relatively speaking, in coming to you with the annual report, but let me see if I can pull it up here.
See, now, I didn't even say that, Richard. I thought they were going to be impressed that you were early.
I'm not early. Nice try, but
I had it going. You blew it.
okay.
Okay.
So it is, the annual report is in board docs, and I appreciate you accepting that and placing it on file, but I did want to go through a presentation with you, the report like I did last year. It does include the sections that you see up on the screen at this point in time. We did have some really nice client testimonials. We always do. Talk a little bit about public health and healthcare integration, environmental health, personal and preventive health services, health education promotion, and emergency preparedness. So this is one of the client testimonials. I think we take a lot of great pride in this particular program. It served 289 women and children in MIHP, and this is a quote from one of the participants in the program. The program has been very helpful for our family. Jamie is one of our social workers, has helped advocate with our DHS worker, helped connect us with other helpful services, and has worked with co-worker Ellen. Ellen was very supportive with helping to get our fussy baby services, as well as giving us pointers on what we could do to help make her feel better. Family is very thankful for the services we've been provided. Our baby is much happier and feels better through the advocating and support of the MIP team. Thank you so much for all of your help. Chelsea Baxter. Another comment from a person who participated in the car seat safety program. It's helped us out tremendously with us being a military family. We move around a lot and also travel a lot. We are so happy our daughter has a safe car seat. We also have learned a lot that we thought we knew, but we were wrong. I wish there was another way to thank you guys, Sarah Frey. Just as a kind of a reminder, when we have participated in community events at the Green Market or with the state police at the Grand River Brewery site, if you will, in conjunction with Henry Ford Legion's Health, what we typically find is that between 80 and 90% of car seats are installed incorrectly. It continues to be a big problem in the community, but I think these events really help parents learn the correct way of putting their seats in, making sure they have them, and that old seats that are no longer good, if you will, they actually have an expiration life on them, are taken out of service and replaced with free seats offered through the Michigan State Police.
I think your timing on this issue here is, in bringing it up in this conversation, is crucial in that a lot of individuals in the community, has always been one location you can go, and that was the Toy House. Whether you purchased your car seat from them or not, Toy House was excellent in that regard of making sure families had their car seat in appropriately. So, yeah, definitely to be able to promote that even further so that the public knows that there is another place to
Yep.
go to have that checked.
Absolutely. We have been doing car seat safety checks like that for as long as the program's been here, over 10 years, and we'll continue to support those needs in the community. Public health and healthcare integration. The Access to Care Coalition continued to meet in 2015, and I included a little graphic here that kind of tells you how we do the work and all the partners that are involved in this. We really are looking at trying to identify any kind of health services access issues that pop up in the community, whether it's we need to bring a new service on board, whether there's a services presence that might be threatened in the future because of loss of funding or other issues. We bring them to this group, we talk about them, and try to figure out some strategies to either preserve them, replace them, or otherwise find a way of keeping a service going here in the community. So that's what we do through that little process. I've already talked a little bit in my monthly report about the state innovation model being us being a regional pilot site. We also have had an ongoing effort this year with Henry Ford Legion's Health and Prevention in Community Health and the Jackson Health Network to coordinate monthly health awareness topics. So each time you see something come out from the health department in the form of a press release or a public health advisory, or we're trying to educate the community, it's coordinated with the Jackson Health Network and their provider staff and their prevention and community health staff. And we did complete a mental health provider survey last year as well. We're still trying to complete that report, and when we get that completed, I'll give you a summary of that as we get that prepared with our community partners through the Behavioral Health Action Team. In environmental health, just a quick snapshot on where we're at this point in time in 2015. We finished with 216 sewage disposal permits, and that's actually up 30 from the previous year. So we are seeing some economic rebound and some activity starting to occur. At least we did in 15. We're hoping that'll continue right through 16. That's a good indicator or a barometer, if you will, of increased activity in the community. The number of water well permits issued was 234. That's up by 20 over 2014, and they kind of go hand in hand with sewage disposal permits as well. Again, another one that seems to tie in very well with what we just talked about is the number of soil erosion permits that are issued through the health department. 119 in 2015. Again, that's up from what it was the previous year. In personal and preventive health services, I highlighted immunizations. We gave 5,609 in 2015. That is a continued decrease from 12, 13, and 14. As I mentioned last year, other providers are emerging in this particular market, and particularly that's the pharmacies, the commercial pharmacies in the community who now have the ability to administer vaccines to adults. So we're glad that that's occurring. Any way we can raise the immunization rates, we're in favor of that. And we are now working together with the commercial pharmacies as best we can through the Immunization Action Coalition that the Health Department started late last year. So that meets on a quarterly basis, and now we have a representative from the Rite Aid Pharmacy who's working with us. And so she comes to kind of represent the interest of the commercial pharmacies in the community. And one of the things we really want to see happen is more of the vaccinations that are given entered into what we used to call the Michigan Children's Immunization Registry is now called the Care Information Registry, and adults can be placed in there as well. So it's a good way for us to manage and monitor what the immunization rates are in the county overall. Sexually transmitted infection rate per 100,000, as you can see, it's relatively stable. We didn't really move much at all from 14 to 15. It continues to be one of the major, I guess, communicable disease infection items in the community that we try to monitor and try to do more about. I think that we're probably not getting to as many people as we need to in terms with the prevention message, and I think we want to do more with other partners in the community who do health education and sex education to try to get them to understand there's a safe way to engage in activity that everybody participates as an adult. We can do more. The number of new HIV-positive cases, I talked about this earlier this year in terms of looking at the distribution and frequency of HIV-positive persons in our community. You can see that we had 13 cases new cases in 2015. That's a kind of a decrease from previous year. Still, it's as high as it was in 2013. And again, as I indicated earlier this year, it's mostly males with males, some heterosexual. Those are the primary risk factors for HIV transmission in our community. And there are some additional things that we're doing with that, as I laid out in that particular presentation to you a while back. With respect to lead poisoning, this is a graph I believe that you're first seeing in this annual report. It wasn't in last year's presentation to you, but I wanted you to be aware that we are making progress with reducing the number of children who test high for lead in our community, from 222 in 2013 to 155 in 2015. That's a continued decrease, but it's still too high, but we continue to work closely with particularly the City of Jackson Department of Neighborhood and Economic Operations to do more with the older age housing stock in the community where most of our lead poisoning is occurring due to lead-based paint. It's not due to water contamination, it's paint.
Richard, on that slide right there, how do the numbers of the individuals being tested, children being tested, compare? I mean, my guess would be, common sense would tell me more people are having their children tested simply because of the media piece of it and the curiosity they may have now that they did not have prior to some of the recent events.
Generally speaking, we've seen about a 1% to 3% increase per year over the past 5 years in the number of children tested. But part of that's because we've been very aggressive about it at the Health Department through the WIC program, but we've also been working with healthcare providers through the Jackson Health Network also to increase testing from their perspective. We do about half of the tests in the community on an annual basis, and the Center for Family Health does just about the other half. We do have some pediatricians that test as well, but there's more testing that could be done. We're probably only testing maybe 35 to 40% of children who live in aged older housing stock who should be tested. And that's true whether or not children are covered by Medicaid or not. Medicaid is an additional risk factor because it oftentimes places them into that kind of housing due to income constraints. Overall, we didn't see what I would describe as a huge spike in the number tested as a result of the Flint crisis. We just had a lot more inquiries and phone calls about it from people who were concerned about their water supply at the local level.
All right, thank you.
Yep. In health education and promotion, a couple of our big programs in the health department is vision screening and hearing screening as well. This first slide here is about the number of children vision screened, and that was 13,801 children that we screened in 1 year. This all takes place during the school year, during the 9 months of the school year. So it's kind of compressed into those 9 months. And what I'm sharing with you here is that we had about 14% of the children who were vision screened that were referred for follow-up in school year 13-14. That's actually in school year 14-15, that's a 4% decrease from 13-14. So 14% of kids. And then the percent of children referred for follow-up that were actually seen by a physician was about 45 kids, and that's up 7% 45%, up 7% from the school year 13-14. So one of our performance measures in this program is to figure out ways to encourage and incentivize in some way or another parents to get their children further seen by a physician to evaluate whether or not they in fact have a vision difficulty. If a child can't see and a child can't hear, they're not going to learn in the school system. So that's a big effort behind why we do this. On the hearing side, 8,520 children screened. That was 3.3% were referred for follow-up, and that's a 0.1% increase from the school year 13-14, not much of an increase. 41% of children referred for follow-up were seen by a physician. Again, it's running about the same thing as the hearing, 45, 41, and that's 11% decrease from school year 13-14. So we're concerned about that, not getting as many kids in to see a physician as we think should happen. So we've got to do more to try to increase that, to make sure we don't have children who are having hearing difficulties in the school district. The WIC program, clinic-based caseload, is often exceeded. The peak enrollment in 2015 was 5,307. That was a slight decrease from 2014. And we had, in Project Fresh, 238 participants, 61.5% coupon redemption rate, and it's about 0.5% higher than the state overall. That's a pretty good redemption rate, relatively speaking. Health education and promotion, we also track, working with the Wellness Committee, the number of HRAs provided to county employees was 207 in 2015, which is a decrease of 3% from 2014. The number of employees participating in behavior change opportunities, 2,443, which is a 3% increase from 2014. So those are pretty good numbers. They could be a lot higher than that if we had more staff participate in the It's Your Life program and the Healthy Blues incentive. In the area of teen pregnancy prevention, we had a pregnancy reduction in teen pregnancy rates since 1990. It's 14%. We had a 144% reduction in teen pregnancy rates since 1990. It's huge. And that's a 14% decrease from 2012, 2014. So we're doing really well in teen pregnancy prevention. We're really pleased to be able to do that, working with the community. And how much more likely are teens in the city to become pregnant than teens in the county? Well, teens in the city are nearly 3 times as likely to repeat a pregnancy. And we continue to work on this with the Teen Advisory Council and the TPPI initiative. It's just a matter of fact that the city of Jackson tends to be about 6th in the state in terms of cities its size with its teen pregnancy rate. That's where it ranks, and we're doing all we can to help reduce that further. And a lot of the things that we're doing, many other places in the community through many of our coalitions will help to reduce that as well, when we can do a better job of addressing the social determinants of health and financial stability and everything else that we work on through the HIO and the Financial Stability Network. This is what the teen pregnancy rate looks like visually, which is probably a much more easier way to visualize what's going on with it. It continues to decrease, but so has the state overall, and our objective is to get below the state rate. We got pretty close in 2011. We bumped up a little bit in 2012, but we're still on that downward decline, which is the direction that we want to be going. So this is more of a bar chart look at the teen pregnancy and birth rates between the county, the state of Michigan, and the city of Jackson. Yep.
Stop you for a second. That's all right. That's all right. No, yep. No, go.
I was just so.
City. Right. Cities 20,000 population or more. Right.
I'm just looking at back to the one chart.
Per 1,000 females. No. No, this is a rate per 1,000. Age 15 to 19. Yep.
Just missing a 0.
No, we don't want to miss a 0. So this is kind of what it looks like for us in terms of the pregnancy rate. You can see what it is for the city of Jackson. It's the 84.2 for the pregnancy rate, and the birth rate is 55.9 for the city as well. The county's in between the city and the state. In emergency preparedness, Okay. If it's going to go, there we go. We developed an emergency reference guide in 2015 at the Health Department. This is really for all kinds of different emergencies that might take place within the building setting. We've shared that with all the other department heads in the county, and hopefully those have found it useful, have gone ahead and developed an emergency reference guide for that purpose as well. We developed an active shooter plan and provided instructions to all tenant departments in the Human Service Building. We did that last year. And of course, we do our periodic response testing and exercises at the Health Department that we're required to do with the funding we receive from the state agency. So that's pretty much everything I wanted to share with you in the annual report, and I'm happy to answer any questions that you might have about it.
Commissioners, any comments or questions for Richard? Seeing none, thank you for all that information.
You're welcome.
That leads us on to the claims from November. We have a motion and support to approve the claims as printed. All in favor say aye. Opposed? Other meeting minutes, there are none this month. January reporting schedule will be coming up shortly. That leads us to public comment. Is there anyone? Yes, Mr. Williams. Should we set the timer? That was a joke.
That's not.
It's okay. It's pretty bad when you have to preface something with it's a joke, right?
Thank you. This is my oldest son, Brad the Third.
Oh.
He has a son, Brad the Fourth. You guys can run, but you can't hide.
So you're John's brother. Well, welcome.
Thank you. These are my friends.
Yes.
And I
Yes,
say that
we
loosely, but I really do.
We
like
are. We are.
it. Madam Chair,
Yes.
I would like to thank you for all that you have done for the DHS MCF board and our facilities. You've been excellent in what you do, and you are very supportive, and I hope and pray that the individual that will replace you will be able to attend and do what you did. Thank you so much.
Thank you for your kind words. It's been my honor and privilege. Any other public comments? Seeing none, any other committee member comments? Seeing none, we'll adjourn to the call of the chair.